Hi, my name is Michael Opiyo, and I have the privilege of taking you through this topic of understanding COVID-19 disease prevention. Ladies and gentlemen, we are very aware this is not a new term to almost all of us because from last year, December, we kept on hearing about COVID-19, 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 or coronavirus. Until now, it hit our country early March, and that meant that every aspect of life had to be shut down, basically to be able to contain the spread of this disease. So today, I'm glad that you're going through this session to be able to understand how the disease is, what is it caused by, so that you can be able to take a lead role as a healthcare worker to prevent this disease. I will start by giving you some of the updates. These are the updates as per the 4th October 2020. And it's just the total number of cases that have been confirmed worldwide so far, and particularly in Kenya, where we are living, because we are Kenyans, and therefore we need to understand where are we lying in regards to the world. And basically, we need to understand that what is the relative percentage of Kenyans infected globally, the relative percent of Kenyan infected globally, of course, when you compare, or what is the percentage of patients who recover from the disease in Kenya compared to those globally. You would want to understand that. Also, what is the percentage of those who die in Kenya compared to those globally? And based on the statistics that I'm going to share with you or to show you, why do you think COVID has been declared a pandemic with severe socio-economical consequences, which leads to shut down, people lost job, or quite enough companies had to lock down, the institutions and all that. In Kenya, actually, as you can be able to see the data versus the worldwide, like the total cases of that the world has now reported. This is as per Sunday, 4th October, we were slightly above 34 million, that's 34.8 million people who were infected with this COVID-19 since its start in Wuhan, China, 34.8 million. And in Kenya, we've recorded so far 39,427 cases. Among these, worldwide, the total number of the recoveries stands at 25.4 million people who have actually been able to recover. That is a good number. And also in Kenya, we are also doing well in terms of those who are able to recover. It stands at 26,659. The death fatality stands at 731 in Kenya, whereas in the world, slightly above 1 million. So we're talking about above 1 million. And the cases are still there. They're still continuing to spread. That's why we're calling it a pandemic disease. But we hope that once we get to understand how this disease is being transmitted, then we are in a better position to be able to prevent or even curb it. So it is a global pandemic, and I want to agree with that because as you can see from the distribution charts, like almost all the countries in one way or the other have a touch of COVID-19, apart from some few countries, like this country that you can be able to see here. That is a corona-free country. Maybe as a good student, just to refresh your geography skills, can you remember which country is that, or can you locate which country is that? There is another country here in the Asian continent. Probably can you be able to isolate or locate the country? But what we want to understand is that this is a 14-day COVID-19 case notification rate as per every 100,000 people. The total number of cases that were confirmed at a certain region or a certain country in the rate of every 100,000 people. And this was taken by as of 27th of September 2020. So you can see that those countries highlighted in yellow, which are major parts of Africa, as you can be able to see, the parts of Egypt, you come back to Sudan, there is Ethiopia, Somalia, Kenya, You move there, you meet Tanzania because it is highlighted a different color. You come down to Mozambique, slightly before you reach South Africa. All these countries you can now be able to see. They're actually highlighted in yellow. There is another one down here. And there is also, you can be able to see some other parts of the Asian continent, actually, they are colored yellow. That basically means that the rate of transmission, even though it is there, but actually it is less than 20,000 people per every 100,000 heads confirmed positive cases. Whereas you can see this dark color in most part of the South America, be able to see this dark color. Actually, that means that the rate of transmission is equal to or greater than 100,000. Yeah, 100,000. So that means that there is high infection rate and some other parts of Northern America. So there are other factors that are contributing to this. There are factors that are actually bringing or contributing to this. And that's why we're saying that it's a global pandemic. Global means across the world, all over. In one way or the other, it basically means that almost all the countries in the world, in one way or the other, they have a touch of this COVID-19, with an exception of the 2 or 3 countries in the world which are corona-free, as per the WHO declaration. So this actually tells us that we need to be very careful, because it does not, it doesn't say, this is a disease that doesn't have like boundaries, that it cannot pass to go to another country, but it spreads across. So it's our sole responsibility to make sure that we are able to prevent this as much as we can. There are important terms that I want us to understand even before we proceed. And these terms are, as you can see them displayed on your screen: endemic, epidemic, and pandemic. They are simple terms, but at times it is very difficult to get their meaning once you just read and pass through. So you can see we have a root word or a suffix, demic. This pertains to a certain population or to a certain group of people somewhere, and therefore now we bring the prefix endemic, epidemic, pandemic. So when these words are added to this prefix, they actually bring more or less close the same meaning, but a bit different. So in your own words, what do you think the word endemic mean? Epidemic, what does it mean? Pandemic, what do you think? So when we talk about endemic, we are saying that this is a spread of a disease or a spread of a certain disease within a locality, where the transmission actually is very fast. But over a certain period of time, we find that this spread, the numbers will remain constant after a certain period of time within a locality, within a small geographical region, for the word endemic. And as you can see from the graph, actually, you'll be able to see that there is the spread, which is very fast, but as the time goes by, then the number of cases tends to remain constant. Epidemic, that means that the number of cases keeps on increasing, within a particular region, within an geographical area. So the disease keeps on, or not, the number of cases keeps on increasing. So the transmission rate is shooting, is going up, and it can now start, being widespread. And once now it spreads to several countries or several continents, then at that level, now we call it a pandemic. That means that an epidemic that occurs at several continents, it has really spread very fast. The number of cases have really increased, and therefore it is affecting almost majority, good part of the world, and the disease, you are calling it a pandemic. Just like now, corona, it is a pandemic because you find it in Asian continent, you find it in Africa, you find it in South America, you find it in North America, you find it there, in all the continents actually. Same case, we're asking ourselves, is Kenya safe? Definitely. What do you think? Are we safe from COVID-19 or corona virus pandemic. What do you have to say about that? Actually, we're saying that anybody is at a risk of this disease, me and you, as long as we are humans, we are at risk of this condition. Doesn't have boundaries like this baby, this is a child, or this is an adult, or this is what. No, it cuts across. So that means that you can get COVID-19, I can get COVID-19. And therefore, it is our sole responsibility to be able to protect ourselves. So actually in Africa, there are other countries that actually are heavily hit by this disease. Countries like Egypt, countries like South Africa, country like Algeria. These are actually countries that are actually hit very high. They report high cases of high cases per day because of the transmission. Countries also like Tunisia, Morocco, say, yeah. So they're actually getting more cases compared to countries like Kenya and most of the East African countries, with an exception of a country like maybe Tanzania, where we've not been having new cases. Although they were reported, but then we have not been having any new reported cases. So Kenya, actually, we are not safe from the disease, but what is going to make us safe? It is you and me taking the precaution that can make us be safe. So what do we need to understand? We need to understand COVID-19 to be able to prevent it. And from this, what do we need to know? What are our objectives? One, what causes COVID-19 or this coronavirus disease of 2019? What causes it? We want to understand. How is it spread? That is something that you need to know down so that you can be able to know, because once you know how something spreads, then you can be able to prevent it effectively. How is COVID-19 spread from one person to another? There's the general spreading, but how does it move from one person to another? Is it airborne? Is it droplets? Is it anything that you can think? So we want to understand. And what are the signs and symptoms of this COVID-19? You are a healthcare worker. Once somebody comes with some strange illness, are you able to identify? Because then if you don't identify this in good time, then you might be putting yourself at risk. How do we prevent COVID-19 spread? How do we collectively as NCMTC community stay healthy during this COVID-19 times? We need you because the world still needs you. You are the future of this country and the world still requires your services. So how do we, because when we keep safe, we are keeping NCMTC community safe, and even those other people, we are keeping them safe. So how do we collectively as NCMTC community stay healthy during these COVID-19 times? How do we help communities, families, and even individuals around us to understand COVID-19 and therefore participate in preventing it? You can prevent yourself, but if that doesn't reflect in the community around you, then you are still your efforts still cannot bear much fruits, because at the end, in one way or the other, you might end up being infected with the disease. And last but not least, what happens if one of us gets COVID-19? So what causes COVID-19, ladies and gentlemen? What do you think? What do you think? Is it a bacterial infection? Is it a viral infection? Or a fungal infection? We're saying COVID-19, coronavirus disease of 2019. It's caused by a virus. Good. And what is the name of the virus? All right. And what is the class into which we are saying the coronavirus belongs? That is the answer. That which you're thinking is the answer. So let's have a look at how is this COVID-19 spread. The COVID-19 actually is spread through the droplets from one person to another. What do I mean when I say through droplets? When someone speaks, when someone coughs, when someone breathes, when someone sneezes, they release droplets. Now, when these droplets come from the person who is infected and the other person is of close proximity to you, then you're at risk of getting in contact with the contaminated droplets, and therefore you are at likely risk to be infected with COVID-19. So it is through droplets from an infected person to a person who is not infected, through breath, cough, sneezing, or coming into contact with a contaminated surface. And through that can either be the doorknobs, the working place, maybe the place where we share quite a lot of things. So when people who are infected one way or the other, they keep on coughing, they keep on breathing, they keep on sneezing. So those droplets that are being released, now they get into contact with a person who is of close proximity. So it is through droplets. But how is it different from airborne? We get to that. So COVID-19 spreads from one person to a person, mainly when someone with the virus speaks. Yeah. And when you touch, for instance, when you come into contact, then you expose the same to the openings in your body, maybe through the eyes, the nose, and the mouth. I think you're also putting yourself at risk. And I remember when this disease was coming, when the members of parliament were trying to put measures to curb this coronavirus. I remember one of these MP, Professor, I don't know what's her name. She was trying to say that one of the way to prevent coronavirus or COVID-19 is to avoid men. And it was like it was raising some men's eyebrows. So how do we avoid men? But it's just an acronym that means men stands for, M stands for mouth, E stands for eyes, and N stands for nose. So avoid men. Yeah. So avoid touching your mouth, avoid touching your ears, eyes, and avoid touching your nose, because they're the openings that can allow, that can serve as a portal of entry to this virus. Therefore, you need to try as much as you can to keep at least a minimum of 1 meter or 1.5 meter. So when from somebody who is coughing and has these flu-like symptoms. Whereas we don't know when or for how long these droplets can survive on the surfaces, but we know that simple disinfectants can kill the virus. So it is our responsibility to, after we understand the spread, then how can we now be able to curb this? But let us see, how do we differentiate from droplets and airborne transmission? We have airborne that they travel. So that means that basically when you release tiny particles through cough, through sneezing, you release tiny particles that are carried or that are blown by the wind and can travel a large distance. And anybody far away, of course, can get these, can inhale these suspended particles in the air, and they get infected. But with droplet transmission, once they're being sneezed or coughed, or you spit, and then somebody is of close contact, then that is the time we say that now these are the droplet, in that you're coming into contact with the droplets released, but they can't travel from one place to another like when we say airborne. Because condition like, let's say airborne, for instance, airborne diseases, they actually, these virus or these bacteria are actually suspended in the air, and they can be blown by the wind to move to a further or a longer geographical region or distance, which can now start infecting people randomly. But with COVID-19, we are saying it is a droplet, although studies are still undergoing to actually hit the nail on the head that it's actually droplet. Yeah. So you find that we are saying it is because somebody has to come in contact. I have to cough, I have to sneeze, and then somebody who is of close proximity to me has to inhale or has to come into direct contact with the droplets. Then at that time, we're saying that that is a droplet contamination, and that's where we are classifying COVID-19 as opposed to airborne disease. Let's have a look at signs and symptoms of COVID-19. So to you, what is a symptom? And to you, what is a sign? The sign that is going to rain, we see the heavy clouds, right? that is a sign. So it is something that shows you that there is something that is going to happen. So a sign is what you can be able to see, perceive, experience, and look out in a patient. So when somebody is coughing, when somebody is having that dyspnea or difficulty in breathing or fever you feel, so it is a sign. So it is able to tell you that this and this and this, pointing out to a certain disease. Whereas a symptom is that which the patient feels, that which the patient complains, that which the patient tells you that actually I'm feeling this. Ideally, they can come complaining of a stomach ache, yet you can't see how the stomach is aching. So it is a symptom. So what are the signs and symptoms of COVID-19? And I'm sure we can mention them. Can you start mentioning? You can count at least 5. 1, 2, 3, 4, 5. Very good. Can you compare whatever you've said with what is on the screen? So these are the general signs and symptoms of anybody who is presenting with COVID-19 virus. So there will be chances of high body temperature, which we're saying the fevers, coughing and sneezing, frequent coughing and sneezing. There is the inflamed throat, saying the sore throat. You feel a lot of headache, and there is the tendency of difficulty in breathing. And all these symptoms actually they start within 14 days of being infected. So in one way or the other, once you've been infected, now they take a 14-day incubation period before now they actually start doing harm to you. And that's why when you find yourself with these symptoms, either flu-like symptoms, you have to keep yourself isolated so that you are until 14 days are over, so that you can be so sure that actually this is not COVID-19, but it is something else. And if in case these symptoms are persistent, then visit the nearest health facility for medical attention. We have the hotline numbers. In Kilifi County, the hotline number. At the school, we have the hotline number. Even the Ministry of Health has the hotline numbers that you can be able to click so that you can be assisted. So what action do we take to protect ourselves, having known what is COVID-19, having known how is it spread, having known the signs and symptoms? So what action or how can you be able to protect yourself or protect the community or protect your family? One of the most important thing is, you can mention that, I can hear you shouting. Another one. Another one. Great, because these are the things that we're just reminding ourselves so that we actually know that they are very important for us to understand. We actually know that once we get to implement these measures, then we are safe. But the most important thing is that follow the government guidelines. And which are these guidelines? As provided by the Ministry of Education, as provided by the Ministry of Health, to be able to curb the spread of this COVID-19. And these are part of the measures of what you've mentioned, that we need to frequently and regularly wash our hands with running water or use alcohol-based sanitizer. Do we know how to wash our hands? Now it has to be regularly. Most of us have only been washing our hands when it's time to eat, time from the shamba, or maybe from the toilet or from the loo. But now it has to be regularly, whether you are going to eat, whether you are from eating, whether you're just, chatting here and there, regularly. At least let's make it a habit that regularly we need to keep on washing our hands with soap and running water. Running water is more advanced because as you are using that water, you're not using it for the second time. So even if you have some microorganism, they're actually being washed away, or even boiled and cooled water. Cough or sneeze into a disposable tissue or bend elbow and wash hands immediately. Remember to dispose the tissue or burn it as fast as you can. Maintain a social distance of at least 2 meters. We're saying between 1.5, 2 meters, equivalent to 6 feet. That one is very ideal so that you don't get into contact with the droplets being released or being sneezed or coughed by the other person who might be infected. Avoid shaking hands, hugging or kissing. It has been a long traditional for Africans that for us to know that actually we are greeting you, even the people from the western part of this country, we believe so much in shaking hands. Mrembe, watu wa Mrembe. We believe so much in shaking hands. Yeah. And our people believe so much in hugging so that we can be able to, so that is how we do greetings. But we have to adapt a new normal. Like now we have to avoid shaking hands. We have to avoid hugging. We have to avoid kissing, especially with people with flu-like symptoms. We really have to avoid them as much as we can. Even though they are our loved ones, even though they are people we've missed, even though they're whatever status, but actually we have to, for the sake of maintaining and keeping your health, stay home and avoid traveling when you have flu-like symptoms until it's so sure that it is not COVID-19. And even so, it is not healthy for you to roam around the streets. It's good to stay at home and until you get well, then you can be able to move, and move only if it is necessary. So persons with coughs or sneezing should stay home or keep social distance and avoid mixing with others in a crowd. Also maintain good respiratory hygiene by covering your mouth and nose while coughing and sneezing, particularly with a handkerchief, a tissue, or a flexed elbow. As in CMTC, how do you want us to keep safe? Or how do you want to keep safe? So as a community, because inside here we are a community. So how do we stay safe? Because if we are not careful, this is a learning institution. People are gathering either in the dining hall, either in the hostels, either in the classes, either whatever. People are coming together, and this disease actually spreads more where there's crowded places. So how do we ensure that we stay safe as a community? We'll basically work with 5 W's, which are the 5 W's for workplace wellness. Temperature check, very important for us. Wash hands frequently or regularly. Wipe down desks and equipment. When you're coming to class, before you use the desk, before you do what, ensure that you're able to wipe and use alcohol-based sanitizer, or you can have these what we calling these wet clothes to be able to wipe, so that you make your environment clean. Because all these things, it has to ensure that we are clean. Has to ensure the only way to put microorganism away from us, it is to ensure that we are clean. And by being clean, we not only maintain those normal flora, bacteria, and microorganisms that maybe are important for our survival and for our health. But these others, we have to be as much as possible to be able to prevent and keep safe and keep health, so that at no region we are encountering them. Wear a face covering as needed or a face mask as required. It is a law, it has been passed, and also it's a requirement by the ministry that you have to wear a face mask. Work 6 feet apart from others. 6 feet apart. The least, at least let it be 1 meter. And that's, you can see even things around those. That is our new normal that we have to keep on adjusting. So it is very important that we understand these 5 W's for survival: temperature check, washing hands, wiping our working equipment, wearing face masks or face covering, and maintaining that physical social distance, as we call it. And what do we do if one of us shows this COVID-19? What do we need to do? Let us support them. We are not running away from them. Let us support them. How do we support them? By ensuring that we call the relevant people to be able to handle such kind of people, so that they can be isolated, so that we test and prove and know that actually this is COVID-19 or something else. Let us not stigmatize these people. Let us not stigmatize these people. Let us avoid stigma at all costs. So what is stigma? We've been hearing it with HIV, but today in COVID-19 also, it's like shy, looking down upon these people. It is like, it is a curse once you have this disease. No, it is not a curse. It is just like any other normal disease that probably comes. And therefore, we need to support these people, moral support, or any kind of support that is required for us to be able to help these people to be able to cover up. From that picture, you can see our CS, the Minister for the Cabinet Secretary for Health, that is Mutahi Kagwe. with some of the COVID-19 survivors. You see, once you heal from this disease, it is just like any other malaria, like maybe flu or any other disease. Once you're able to heal, then you're perfectly all right, because then you're being tested until they prove that actually you're okay. And by this good thing is that you are now developing the antibodies, and therefore now the rate of infecting others actually is very minimal. So let us support these people, let us encourage them, let us know that they are our own. So if we find somebody today in North Coast or sitting next to you who is maybe these symptoms, then it's always good to actually advise them to be able to seek for help. And even if you know that you have these symptoms, value your life and value the life of those that you love. Yeah. So to isolate yourself, to report these cases, the Ministry of Health or the nearest health facility, or even in school here now, we have an isolation center whereby we can be able to observe you, so that we are so sure that actually whatever you're having after 14 days is not the COVID-19 or else. And of course, we're saying that testing is the surest way to confirm infection. So therefore, you will want to be tested. I'm sure people have been, by the look of things, some think that thing is very painful to be tested. No, but maybe it might be as how people have portrayed it, or how people are perceiving it. Sometimes these things are being exaggerated, but it is very important, because we know that the virus is within the respiratory tract, and therefore we have to swab either the mucus or the saliva. That's why we use maybe we can swab within the mouth or in the nose, so that we get that swabs for the purpose of trying to detect the presence of the virus within the system. So testing is the only surest way that we can confirm that actually this person is positive or negative. So don't fear to be tested. It is very important, so that you know your health and you understand yourself. Because in Africa it's more or less like an asymptomatic. It is an asymptomatic. We're saying in Africa it is asymptomatic. So you might have had the virus unknowingly. And by that, when you tested, you find that you already have the antibodies. Then you are surprised. So it is not something that it's a dreaded disease, it's a killer disease. No, it is actually something that can be managed, unless maybe there are some serious underlying medical conditions, as we have been seeing or as we've been reading from the journals and the new and the published materials, that at least those people with other underlying medical conditions, they are at a more vulnerable state than those with normal immune system. So it's good to be tested, and we need to support one another by ensuring that because this is a disease that can actually bring burden, and bring stress to people. So we need to be able to support each other. We need to be able to see how do we cope with stress, either you or people who are like staying in isolation center for 14 days. It's almost like in a prison. And most people, of course, we are human beings and we are social beings. We would want to socialize. So it comes with its own stress, but it is normal to feel sad or stressed up or overwhelmed during a crisis like any other crisis. But at this state, what do you do? What you do matters a lot. Like talk to people you trust, or a counselor. In the school, we have a counselor, the college counselor. We can connect you, who can be able to help you to get counseling and moral counseling, or that, so that at least you can help each other to bear the burden. Maintain a healthy lifestyle. It's very important. A proper diet, sleep, exercise, and contact those you love, friends and families, and even your enemies, yeah? Because after all, we want to take care of each other. Avoid some of these behaviors that are dangerous to us, like maybe getting into drugs, alcoholism, to deal with emotion is not the best way to do that. Once at that level, you need to watch what you're eating, stay healthy, and if you have concerns, talk with your supervisor. If you start feeling unwell, tell your doctor immediately, or tell the person next to you that, "Well, how I'm feeling, it is not okay. You need attention, and we can be able to help you at the best level we can." What we need to know about preventing COVID-19, let's see on the Mr. Bean's essential COVID-19 checklist. 1, keep your hands clean and don't touch your face. Avoid men. Remember my statement, avoid men. That is, avoid the mouth, avoid your eyes, and avoid the nose touching unnecessarily. Keep your distance of at least 1 meter. Keep in touch with your neighbors and be kind to them in case they need response from you. Keep an eye on the symptoms, and if need, then call the doctor and follow their advice. Are we agreeing that these are just the simplest way that we can do to keep away COVID-19? Are we agreeing that you're going to follow them? Are we agreeing that you're going to abide by them? Okay. They are not tough rules, they're not tough measures. They're actually things that are quite implementable. We can do this, we can practice this, and they become our new normal. Personal hygiene, let's continue practicing it because it is the basis of everything. This is a viral disease and we need to keep our hygiene very fast. So how part of going to do this, because we've done just the theoretical background about this, but we want to connect it to the skills. So if you're saying washing hands, how do you wash our hands properly? You know, not just going and putting your hands there and that is it. How do you wash our hands properly? How do we sneeze with a flexed elbow? How do we do waste segregation? That 1 meter, how do we ensure that this 1 meter is a part of the skills that we will need to involve ourselves in doing that? But the main thing, continually maintain personal hygiene. There's no shortcut about it. So, having learned about COVID-19, what still remains as the uppermost question in your mind? Do you still believe COVID-19 is there? Or it is something that went with people? So we need to understand that COVID-19 disease, it is real and it is there. And anybody can get it. You can get it, I can get it. You get that? So it is about preventing ourselves, protecting ourselves, and ensuring that we are able to protect those that we love and the people around us so that we are safe. Thank you so much for taking your time to listen to this video. If you have any comment, you can go to the comment section and post your comments. I hope you like the video. Thank you.